My name is Dr. Pichotti with QC Core Chiropractic. In this video, we are going to be demonstrating some basic core strengthening exercises. These would be beneficial for patients who are recovering from low back conditions and for general core strengthening just by itself. While the patient is in the recumbent position, there's several exercises that we can do here. The one that we show often is the basic sit-up. With sit-ups, I like to see the knees elevated, feet supported. Have a partner hold your feet, or use the base of a couch in your living room, but I highly recommend that you have the feet supported. Arms always across the chest as opposed to behind the neck. Instructions for these sit-ups is try to reach your elbows to mid-thigh, and doing these as many times as your doctor recommends. While you're doing these sit-ups, concentrating on keeping the abs tight and supporting your low back while you do these, and appropriate breathing, which is to hold your breath as you come up and exhale as you go down. Now, if you find regular sit-ups to be difficult, either because of deconditioned abdominal muscles, or your low back is injured and it's causing you too much pain to do sit-ups, sometimes what we'll do is what we call assisted sit-ups, and we have a wedge, but at home you can just as easily use a big couch pillow or bed pillow to elevate your body a few degrees up from the ground, making it closer to the knees here, and also helping you not to use so much low back muscles to initiate the sit-up. I've found in my practice that patients that have acute low back pain that can't do sit-ups, even in the area past extreme acuteness, and we're trying to get them better, that this is something that they can do. So again, feet supported, knees bent, elbows across the chest, and you come up into the same position. And as you can see, it's reduced the number of, or the degrees of that he has to go into the sit-up position. So. Another exercise that we do while the patient is in a recumbent position is what we call a bridge, or a posterior plank exercise, where you elevate your hips off the ground. Support yourself on the ground with your hands. Again, knees bent, feet on the floor. In this, you elevate your hips, trying to make a straight line between your thighs and your chin. Relax. When you're at the top of that bridge, concentrate again on tightening your core stomach muscles and contracting your gluteal muscles. Come to the top. Contract here, hold it for a 2 count, and relax. Again, you want to do these as many times as your doctor or your clinician recommends that you do. One of the last exercises that we do in this recumbent position is an exercise that we call a dead bug exercise. This exercise is again going to work on the abdominal muscles mostly. It's also a coordination exercise as you're doing cross coordination. I always ask the patient to raise, first initially raise up both arms and legs, and then to extend opposite arms and opposite legs. Now when you're doing this, you're going to feel some tension in your abdominal muscles. Also, you can be working opposite hip flexors. Come back. Opposite side. Come back. Now you can see, as this patient is demonstrating, when you get to full extension, hold it out there for a 1 or 2 count, and as many times as your doctor recommends. Exercises that we do when the patient is in this prone position or facing down. We can start off with the ones when you're on your hands and knees. This is a good exercise for general posterior core strengthening, and again, it's a cross body exercise that works on some coordination. and get the appropriate nervous stimulation. In this position, what we would ask a patient to do is extend your opposite arm and opposite leg out and hold it for a 2 count, and then come back, do the opposite side, come back. Try to keep your back flat here. Don't allow it to sway down. Keep it stiff, again, with your abdominal muscles contracted. Now, if you do this for a time and it becomes rather easy, there is one more variation you can add to this exercise. After you extend opposite arm and opposite leg, totally flex it in towards each other, touch elbow to knee. And this is a good variation which will recruit a little bit more abdominal muscles along with the low back muscles. Lastly, in this core strengthening basic program, what we'll recommend a patient to do is just your basic anterior planks. In this position, resting on your elbows and your toes, elevate your entire body up off the table, trying to maintain a flat, straight posture with your back. Again, recruiting your gluteal muscles and your low back muscles, supporting this for a recommended time by your clinician.